But you can get hospice services whether you're at home or in a nursing home or in ALF, no matter where you are.
So a hospice isn't like, let's go to the hospice building.
No, that's probably most of the patients that I admit say to me, now, are you taking me someplace? You know, because they think you have to go away, but no, you don't.
So if I enter into hospice, can I get out of hospice?
Oh, certainly.
Does that happen?
Oh, yeah, it happens a lot.
How,
so
I does that mean a doctor made a mistake?
No, no.
What's that all about then?
There are just things that happen. End of life isn't as much science as it is art. You know,
If I decide, okay, hospice can come to my home, what does that mean?
Generally, you'll get first. Have a person like myself, an admission nurse, come out and talk with you, find out what your needs are, what kinds of things you need help with, what kinds of equipment you need, if you need oxygen, hospital bed, anything like that, wheelchairs, those all come from hospice. They'll bring them out to your home. And they'll set things up. They'll help order your medication, see to your needs, if there are dressing changes or whatever it is that you need.
Hospice.
Right. A lot of people they'll hire 24-hour nurses' aides or something like that, but certainly you don't have to do that, but some people do.
You know, does hospice train family members?
Yeah, if there are things that they need to do, for instance, if there's a feeding tube and the patient needs to get their feedings that way, the nurse will come in and train the family how to do the feeding tube. If there are medications to be given, she'll train them how to do the medications, injections, Foley catheters, whatever it is.
Now, when I think of hospice, I guess I think of those things, but I guess I really think more of, I'm going to get the pain medication that's right so I don't feel a thing, and you as the hospice person are going to come in and give me the drugs that nobody else can give. Is that, where does that fit in?
No, certainly pain is part of it, but I would say that probably less than half of the patients I admit are dealing with pain issues. So pain isn't always there. And yeah, we do give pain medications quite freely. But I think that the confusion is that people, for the most part, think that hospice is about dying. And hospice isn't about dying.
Well, what's it about then?
It's about living. You see, nobody can tell you how to die or what. Everybody approaches that themselves alone, and we can help support you during that time. But hospice is a set of services and a set of things that are there to help you make every minute that you have left, whether it's 1 minute or a year or a month, the absolute best it can be. So if there are pain issues, we take care of those. If you're having trouble breathing, we help with that. If you're just having trouble bathing yourself every day, we can have somebody with that. Anything that makes you uncomfortable, hospice is supposed to help you with. And that means more than pain. It means spiritual discomfort. It means emotional discomfort. Those are all issues. That's why the hospice is a team. There's a chaplain, a social worker, a nurse, a nurse's aide, and a volunteer.
Okay. So